as of August.
Right. Where's your daughter going to college?
Northeastern.
Oh, cool.
But her first semester is in Rome.
Whoa. Wow.
Okay. Is that right? Hello, and welcome to Your Senior Moment. I'm your host, Dr. Wayne Saltzman, Chief Medical Officer of Continuing Care for Lahey Health, and I'm also the Medical Director for Lahey Health at Home. I'm so happy you can join your senior moment with me.
Sorry, we're gonna do it one more time. One more time. Here we go.
Take 4. Hello, and welcome to your senior moment. I'm your host, Dr. Wayne Saltzman, Chief Medical Officer of Lahey Health Continuing Care and Medical Director for Lahey Health at Home. I'm so happy you can join us today. Before I introduce my guest, Susan Stempick, some housekeeping as always. Those of us at your senior moment want you to know that your voice as a patient is important. Your goals, your wishes drive care. We call that patient-centered care. But what's more important than patient-centered care is your voice when you actually cannot express your wishes yourself. Who carries out your goals and your wishes should you not be able to? In medicine, we would call that your healthcare proxy, someone you choose to be your advocate, your surrogate, when you're not able to advocate for yourself. Choosing a healthcare proxy is easy, and at some point in the future, I'm actually going to do a show on healthcare proxies and advanced care planning. But in the meantime, think about who you would want to advocate for you regarding your healthcare. Healthcare proxy is the only advance directive accepted in the state of Massachusetts. You can find a healthcare proxy form which is easy to complete and doesn't need any legal interventions online, or your doctor's office might have one. Just want to put in your mind to consider a healthcare proxy and consider it soon. So I am thrilled that with us today is Susan Stempick from Lahey Hospital Medical Center. Susan is the Director of Advanced Practice. She is a physician assistant, and physician assistant, nurse practitioner, advanced practitioners, that's what we're going to be talking about today. Her specialty is working in the medical ICU. We know her as Sue. Sue, I'm so glad you could be here for your senior moment.
Thank you so much for having me.
Sue, I think many people have misconceptions or just a lack of understanding in general as to what is an advanced practitioner. People use the terms physician extender, which I know is not correct, but what is the role of an advanced practitioner?
So at Lahey and in many places, the language regarding nurse practitioners, certified registered nurse anesthetists, clinical nurse specialists, nurse midwives, and other advanced practice nurses, as well as physician assistants, have come under the umbrella of advanced practice provider. And so at Lahey, we use advanced practitioner, and patients may hear all of these kind of terms. Our goal is to describe this group in the role working in a team to care for patients. So physician assistants are team members who have usually master's level training or sometimes other type of graduate training to care for patients, and they're trained usually along with medical school classes, but in a shorter time frame with a little bit less detail, and they go through practical training like medical students do. A lot of the training, though, is on the job after training. Nurse practitioners are commonly registered nurses practicing prior to returning to graduate school for advanced detailed training in a certain medical track or specialty.
So a nurse practitioner started as a nurse and got additional training, but a physician assistant started as a physician assistant and their advancement is just based on what you choose to do with regard to medicine.
That's right. And most commonly, physician assistants may have had some exposure to the medical field prior to applying to PA school. So instead of having been a nurse, someone might have been a paramedic or a medical assistant, and that was their introduction into medicine. Functionally, many of these providers fill similar roles, especially at Lahey. That's how people have kind of filled in the medical team.
So when it comes to a patient, is there any difference in the big picture between knowing that I'm talking to so-and-so nurse practitioner versus so-and-so physician assistant?
You know, I think it's uncommon that patients would feel differently about the role. There are certainly some subspecialties in medicine that have traditionally had potentially more PAs or more NPs. That is more kind of historic practice than purposeful in 2018. And even the professional societies have kind of started to talk about the professions together. Although there are some important things to recognize about the history of each profession that are important to recognize. But to your question, I don't think patients feel necessarily all that differently. There are some more specialty certifications for nurse practitioners that don't exist as much for physician assistants, so that may be a specific difference.
So when I was thinking about talking with you, I was reminded a couple of years ago, a gentleman did some work at the house. He learned that I was a doctor, and he wanted me to talk to his daughter about career choices. And it was literally the choice between going to medical school versus going to physician assistant school. And we talked about some things. I hope I said the right things. She ended up choosing being a physician assistant. But when you get right down to it, the nitty gritty, aside from the fact that one person has an MD after their name, what is the difference in practice between being a medical doctor and a physician assistant?
So I think one of the most important things to recognize is that we often practice in teams. So the physician assistant may see a patient with a new problem, or they may see patients in follow-up. And so there may be, depending on the specialty, whether it's primary care or a specialty setting, the way that patients are seen in the practice may depend on the specialty. So I think it's important that patients know what their care plan is, no matter what the provider is. And of course, the physician training is more in-depth. A lot of training for both nurse practitioners and physician assistants is done in their career path. So for me personally, working in pulmonary critical care my whole career, a lot of my learning was done after I completed my graduate training with excellent physician mentors to teach me the more in-depth physiology that I didn't learn in school, so that I can participate in the care of patients with pulmonary complaints and also work in the medical ICU alongside them.
I think that patients, and one of the reasons I wanted to have you here for an educational purpose, I think that patients sometimes think that advanced practitioners, for better use of the term, maybe aren't as smart as doctors. But what I didn't tell everybody, but I'll tell them now, is that you've been accepted to the MBA program at the MIT Sloan School for Business. So you're no slacker. So it has nothing to do with intellect. It really is a career choice. So if you could share with us what led you down this career path, because frankly, the Sue Stempic that I know really could be a physician in any other world. So what led you down this track of being a physician assistant?
Yeah, so that's a great question. I think it could potentially give people some perspective about the why. So my undergraduate degree is in economics, and I became an EMT early in my undergraduate studies, and I learned that I loved medicine as well in a way that I couldn't identify before I became an EMT. And so then I thought, maybe I don't want to go the business track, which is actually what I thought I would do. And so I thought about what I might want to do in medicine. And similar to the person who asked you for your opinion at your house, I thought, do I want to go to medical school there is something called being a physician assistant. Do I want to go to nursing school? And for me, it felt like the right fit to choose a career that was part of the team. I could still treat patients. And, ideally, I wanted to participate in a lot of direct patient education, which is something that we have a lot of opportunity to do as PAs, and spend a lot of time with patients, which has always been my goal because I really like people. So I chose to go to PA school, and then to kind of explain the MBA part of my career goals, I do have an administrative role, and so it will help me be more effective in my administrative role.
And what is your administrative role?
So I'm the director of advanced practice at Leahy Hospital and Medical Center, which means I have a leadership role to serve the advanced practitioners and work with the administrators on strategic planning regarding the healthcare team.
And actually, I think you're being a little humble. You actually are kind of on the same stage as some of the senior leaders, giving input and things like that, but really advocating for the physician, for the advanced practitioner role.
That's right.
That would be fair to say.
Sure.
What are the challenges, and I guess to put it in a more of a business way, what are the opportunities and what are the barriers of being an advanced practitioner today?
So I think, even in the time that I've been a physician assistant, which is about 14 years, the overall integration of the role and understanding of what a PA or NP can and should do, and maybe what's outside the scope, has become much more clear, I think. Although over that period of time, NPs and PAs and other advanced practitioners had been kind of infiltrated in almost every part of the medical practice. So that keeps changing. So I think the answer to your question also is interesting because it might have been a different answer 10 years ago. So one of the things that we find is having the right plan for which provider patients may see with a certain type of complaint or a certain level of urgency is the right thing in different practices. And there are many things that can be independently managed very well and appropriately by advanced practitioners. And then we all also know what we don't know, and we know when it's appropriate to refer to someone with a more in-depth knowledge base.
I know that advanced practitioners are highly regarded in general and do some. I've watched physician assistants in cardiothoracic surgery do some amazing things. But do you find that advanced practitioners are well accepted within the medical world?
I think yes. Although I know that I have colleagues who have had different challenges throughout their careers, and I think we're very fortunate to be well trained, and I think our knowledge base, just like any healthcare provider, a physician, a nurse practitioner, a PA, we all grow our knowledge base throughout our careers. And so I think it has become much more common that it's a known member of the team, and I think that's helpful. So I think yes, it's very common and well accepted in the world. And I also think that it's really important that patients have choices. And so some patients prefer to see their nurse practitioner commonly, and then they would, potentially need to see a physician for something else, and some would prefer to see their physician. And we absolutely, that's a really important thing to respect and have a plan for as well.
And so that leads me to my next question. When I used to do work mainly in the skilled nursing area, I would ask a patient, about their last visits with their provider, et cetera. And they would often say, "Oh, I haven't seen Dr. So-and-so in years. I see his or her nurse practitioner." I have 3 advanced practitioners on my team. I never refer to them as mine. But from a patient point of view, going to a provider's office, whether it's a primary care doctor's office or a specialist, is there any reason to have a concern, and I know the answer to this question already, but is there any reason to have a concern that by seeing an advanced practitioner, by seeing the nurse practitioner or the physician assistant who works with Dr. Smith, that you are getting less out of that visit or not getting as much as you should get out of that visit by not seeing Dr. Smith?
Absolutely not. And, I think one thing that's important to reassure people is our advanced practice colleagues are really well trained to care for patients independently. And so we all, whether we're a physician, nurse practitioner, a PA, we know what we don't know. And it's really, that I think people should feel very comforted that that's present in all of our days. Excuse me. The other thing that I would say is we hold everybody to the same standard of care. And so patients receive the same high quality care no matter who they're seeing. And there's a certain way to care for patients with a certain concern. And that is followed no matter whether you see the physician, the nurse practitioner, the PA, et cetera.
I gave an interview once for one of the local business magazines, and it was on advanced practitioners. And I was asked my opinion of advanced practitioners. And I naively said, I think it would be considered naively today, that advanced practitioners really filled in the gaps that were this was about 5-7 years ago, filled in the gaps. Physicians schedules were overloaded. They couldn't get to see everyone they should see. Patient access was always a question. Would you consider the concept of filling in the gaps appropriate? I guess it would sound almost demeaning to say it, but I guess how are advanced practitioners really affecting the nature of medicine, and how do you see the evolution of the advanced practitioner, thinking about policies, regulations that are changing that have changed in Massachusetts and even in the country?
Yeah, so that's a great question. I think that, so one challenge that we have is the policy changing all the time. So roles for nurse practitioners and PAs do obviously need to be crafted as policies or state regulations change. Those things are becoming kind of more uniform across states, although they still can be pretty different. In terms of filling in the gaps, I think that it's important to think about that in a patient-centered way. And so we all, again, physicians, nurse practitioners, PAs, other roles, we all should care most about serving what patients need. And patients deserve access to their primary care team, to their specialty team, to hospital services when they need it. And so I think increasing the provider base in a way that we can't do with physicians only is incredibly important. And I think that is one of the biggest impacts that we've been able to see as the advanced practice profession has expanded. So nurse practitioners and physician assistants, as well as other advanced practice nurses, midwives, and CRNAs, for example, have been able to really increase access to certain areas of practice that patients wouldn't probably have otherwise. So wait times for surgeons and things can be improved by having a team that's not surgeon only.
So I recently saw that over the past number of years, medical school applications have increased, and there's constant discussion about the future medical workforce going forward. How has demand changed for advanced practitioners? You can speak about physician assistants specifically if you wish, but how has demand changed? Are there more spots now? Have you found that it's become more competitive? If you went to Burlington High School and spoke to the medical interest group, a bunch of kids saying, what should I do? I've heard about this physician assistant, thing. What would you talk about? What would you describe to them about those things?
I think you're absolutely right that there's more demand for NPs and PAs, and I think as our population grows, there's been demand for physicians and demand for these healthcare team members as well. I think the message to young people is, I think all of us who want to work in healthcare, it's really important to do it for the right reasons and to want to take really excellent care of patients, no matter what your role on the team is going to be. I have found being a PA an incredibly satisfying career. I'm able to participate in research. I've really enjoyed my leadership role. I hope that I can have an impactful interaction with patients and families every day that I work in the ICU. So I've found it to be a very satisfying career, and I certainly would recommend it to others. That said, I think on behalf of all of our professions, it's really important that people become an NP, a PA, a physician for patient-centered reasons, so that we can ensure that the healthcare team and the healthcare workforce continues to focus on what's best for patients.
So I'm going to throw you for a little bit of a loop. There is some legislation out there right now, pending legislation, that may affect the number of nurse-to-patient ratios in the hospital. Namely, that there should be a specific number of nurses attending to patients at all times, without going into detail. If that legislation were to pass, that would increase the demand dramatically for nurses in the hospital. So just kind of thinking outside the box, how might that legislation affect the ability for nurses to move forward and become nurse practitioners? Do you think it would play a role?
It could, and I guess it depends exactly how the legislation plays out. But I think what we would wonder is whether as many nurses would have the opportunity to expand their education if there's a demand for that many more bedside nurses, if you will, which is what it would potentially increase the demand for. So I don't know. It would change the landscape of the healthcare workforce in ways that I don't know if we can predict yet, but it could change that.
It's just something that I think we're all thinking about today. I know you are not a nurse practitioner, but you oversee many. What is the typical relationship between a nurse practitioner and a nurse on the floor? Is there more so a sense of collegiality and just understanding of each other's roles? And I'm thinking about the physician-nurse relationship. Physician writes orders, etc. But nurse practitioners and physician assistants write orders too. And how does that relationship, the integration with other multidisciplinary teams, work? And has it been a concern? Has it evolved?
I think it has evolved. I think evolution is a great term, and I think my nurse practitioner colleagues have a really wonderful understanding of all the roles on the team, especially those that have had the opportunity to be a bedside nurse and then have gotten their graduate level training and have come back and work in an inpatient setting as a nurse practitioner. And they really understand the demands on the nursing colleagues and have a wonderful respect for the added value of the knowledge of the bedside nurse and their relationship with the patient to bring that to the healthcare team. So that relationship, I think, goes very well. And I think that all of our advanced practice colleagues take the opportunity to spend a lot of time with patients, which can make the whole team discussion about the patient very high quality.
How does somebody in advanced practice, I know you are getting your MBA, but you are unique. How does somebody go about advancing their roles or their career? Do advanced practitioners, aside from you, typically consider doing those things?
Absolutely. So there is an increase in the offerings for even more advanced degrees in the world of advanced practitioners. So nurse practitioners have readily available to them the option of pursuing a doctorate nurse practitioner degree, which some of those speak to leadership, some of them are a little bit more clinical. So that's certainly an option. Of course, many of us could seek a degree that's technically outside of medicine, but helps with a certain facet of our career, which is what, my choice in that arena was. And then there's also other educational opportunities. So I've been involved in some professional societies to kind of try to spread the education of advanced practitioners outside of just my hospital where I work. So that's also an option. And, I think growing one's career by, even getting more knowledge about how to do research or, a master's degree focused on that. So in a way, the world is our oyster, I think, in terms of expanding our educational opportunities once we've been in clinical practice for a little while and can kind of focus what our interests might be.
So a topic that comes up, and it actually came up on my home society's House of Delegate floor, had to do with advanced practitioners who go for a doctoral degree. So a doctor of a nurse practitioner who ends up being a doctor of nurse practitioner, and introducing oneself to patients and the confusion it might create when you have, even though it's kind of more of a PhD type level, how do your colleagues integrate or relate to patients? Would they introduce themselves as Dr. So-and-so, a doctor of nurse practitioner, a doctorate level nurse practitioner? Have we reached that point where we really need to kind of even out the playing field, and how do we integrate with patients in that level?
So I think it depends on the person, what they might choose to do. And it may also depend whether they work in a very team-based environment, standing next to a physician, or if they're more in an independent setting, seeing patients and is a physician less involved. So that might be one answer to that. We don't have a lot of experience in our groups with that in the current state. Certainly we have a lot of people that have pursued or who have their doctorate nurse practitioner degree, but we have not had a lot of that conversation. So I think probably most of my DNP colleagues continue to introduce themselves as a nurse practitioner. I actually am not really here to speak to what the right answer is, and I think you're right, it's kind of an evolving conversation.
Yeah. So the Lahey Health System, among its 3 hospitals, Winchester Hospital, Beverly and Addison Gilbert, and Lahey Hospital Medical Center, made a rather momentous decision in 2016 when they redid the bylaws. They actually, and I was very proud to be an advocate, they actually decided that advanced practitioners should have full medical staff, be a full member of the medical staff. So what did that mean for you and your colleagues? Was it just part of this evolution to you? Was it a statement? And how have the advanced practitioners kind of, for better use of the term, stepped up into now being true, fully fledged members of the medical staff?
So I think it was a really high quality recognition of the team and what healthcare really looks like today and who's providing it. So the medical staff now recognizes that group as healthcare provider colleagues in the way that we practice every day. So I think that was really meaningful for the advanced practitioners. And then I think the other piece to that in terms of how people have stepped up, I think the advanced practice colleagues, feel much more recognized as that true colleague and team member. And it's given us a platform to have those discussions too, to say, hey, I think we need to have this conversation with all the provider team members about, whatever, the most updated way to care for X problem. For the most part, that's been happening in our institution for a long time. So this was a recognition of something we were already doing. But I think it's also a statement about how we care for patients and why that's best practice.
Did your advanced practice colleagues, were they happy
Absolutely.
to hear about that? What about on the other side? Has there been any kind of, I don't want to say pushback, but has it been felt that the physician providers have also been accepting of this as well? Or is that an evolution as well?
I'm sure that what this looks like in 3 to 5 years will be different than what you and I and others know it looks like right now as we learn to behave like a collective medical staff. But I've really heard nothing negative, and I think most of my physician colleagues feel like this is a recognition of how we practice in 2018 and beyond.
Yeah,
And this is
absolutely.
the model.
Absolutely. So the long story short is advanced practitioners are, for all intents and purposes, as crucial to our medical system as any other provider, and advanced practice is something that anyone who has a vision for patient-centered care could consider as a career that is viable and thriving and evolving and important.
I think that's great.
Okay.
I agree.
I've-
I'm a little biased, though.
I've summed it up. So Sue Stempic is an example of excellence in our community and an example of, and plays a role that is extremely crucial, as do her colleagues, in medical care. Sue, thank you for coming today.
Thank you so much for having me. This is great.
It's been a pleasure. So as always, thank you for spending your time and for sharing your senior moment with us. Take care.